New study shows that the flu vaccine may cut heart attack risk. Dr. Richard Chaffoo is here joining us with more. So you're getting this vaccine thinking you're protecting yourself from the flu, and what a season it has been.
Very much so.
But you're protecting your heart as well?
You really are. Shally, the thing is thought to be that there's, when we get the flu, there's a heightened inflammatory response. And what's thought to happen is that there's actually an inflammation of the coronary arteries, the end arteries of the heart, and in someone that has underlying heart disease where those arteries are already narrowed, the inflammation may be enough to actually close off one of those arteries and cause a heart attack.
So if you do the vaccine, that is supposed to help your heart then?
The studies seem to indicate that it reduces the risk of getting the flu, number one, if you get the vaccine, and number two, it reduces the severity of your symptoms. So we know that people that have underlying cardiac disease that get the flu are 6 times as likely to suffer a heart attack than someone that doesn't have heart disease that gets the flu.
Okay, so what age range would this apply to?
So these are older people, people in their 60s and 70s, which would make sense because that's a typical age for people to have coexisting heart disease.
And then do you think that all heart patients, people who may have underlying heart issues, they're going to start recommending this?
The CDC does and the American Heart Association both recommend. Of course, you always check with your doctor beforehand, but yes, it seems to have that protective effect. We don't know whether it's actually that the inflammation is reduced or there's an alteration in the immune system, but one of those two factors is related to it.
There was another study, Dr. Chaffoo, that we spoke about, I think it was last week, or yeah, that was last week. Cleaning products can be harmful for the lungs. So basically they were saying people, especially women who are using these products and the men using the same products, it's affecting the women more?
Well, it may be because it's more women in the study than men, so it's a small sample size, so it may not really relate to your sex, but it was an interesting study that came out of Norway, and they looked at people that clean, either at home, or more often professionally, and they found that if people clean and use these cleaning fluids, that after about 20 years, their lung function is actually reduced, and it's almost like smoking a pack of cigarettes for 20 years.
Dr. Chaffoo, let's be honest. When I've opened a bottle of bleach and I've needed to clean something out, it's like, whoa, what is that smell?
Very strong chemicals,
I can feel like something is burning.
Yes, and this is what happens. It goes into our lungs, and the small airways called the alveoli, where we exchange air. It's probably chronic irritation, much as if you would smoke. So the key is, obviously, as you said, you want to limit the use of those types of chemicals, have an area well ventilated.
Okay, so there's obviously the short-term effects of these things. You could feel it, and then there's long-term.
Yes.
So we obviously need to clean our homes.
Right.
So what would the recommendation be?
So you're right. We don't want to use those astringent chemicals that are very harsh when we inhale them. There are wonderful solid cleaners or liquid cleaners that we can use, placing on a mask, making sure the area.
Does the mask really help?
It can help, but most importantly, you want to have the area well ventilated and limit your exposure. Avoid anything with an aerosol or a spray because that's more likely to get into your lungs.
Got it, Mr. Martinez. So next time you clean the house, wear a mask and use a spray. Dr. Chaffoo, thank you for being here.
Thanks, Shally.